Hi, my name is Lena Hall, and I'm here today to inform you, the public, of the health emergency our country faces with the opioid epidemic, the resulting loss of life, and ways you can assist. Specifically, I'd like to talk about how the epidemic has hit Rhode Island and our community's response with education and distribution of naloxone, which is the opioid antidote. Great acts are made up of small deeds, by Lao Tzu. As a nurse working in a local primary care office, I see the struggles of my patients fighting opioid addiction and how it takes control of their lives. I feel it's important that the community is aware of the effects that this devastating epidemic has caused on the loss of life and what they can do if they come across an individual who is overdosing on drugs. Opioid addiction and overdose is a global epidemic and a national health emergency that requires all citizens to be knowledgeable of signs and symptoms of overdose and what they can do. Per the Rhode Island Department of Health, Rhode Island, the smallest state in the Union, leads the country in the number of opioid overdose deaths, ranking 10 out of 50 states in this nationwide public health emergency. Nationally, every day, 130 people die of opioid overdose. And per the CDC, in the past year, emergency room visits for suspected overdose has increased by 30%. Our community is struggling with this surge of prescription and illicit opioid misuse, addiction, and overdose. In 2020, the Rhode Island Department of Health recorded 384 accidental drug overdose deaths, which was up from 308 in 2019. And per Prevention Overdose Rhode Island, this is more than the number of people who have died in car accidents, murders, and suicides combined. In order to address this nationwide public health crisis, Rhode Island has developed a strategic action plan to address this epidemic. The action plan focuses on prevention, rescue, treatment, and recovery, with the main strategies of increasing the number of people receiving medication for opioid use disorder every year. Additionally, increasing education of the layperson to recognize signs of overdose and life-saving interventions they can use on an individual overdosing. We all have a role to play in ending the accidental overdose crisis, and one way you can help is to learn the signs and symptoms of overdose and take action where you see it happening. You can become educated by taking the online Community First Response Naloxone Narcan training program, which is provided by the University of Rhode Island. Through this program, you will learn what opioids are, symptoms of overdose, as well as any ways an individual can help. An opioid is a drug that attaches to the nerve receptors located throughout the body and blocks our response to pain and gives you feelings of euphoria. Common opioids include Vicodin or hydrocodone, oxycodone, which is also known as OxyContin or Percocet, methadone, fentanyl, and heroin. Additionally, fentanyl, which is 50 to 100 times more potent than morphine, is being added to opioids being sold on the streets illegally, causing the death rate from overdose to increase by 59% per the National Institute of Drug Abuse. It's important to know the signs of overdose, which usually happens in 1 to 3 hours after a person has used. And per the Rhode Island Department of Health, they include falling asleep, heavy nodding or being unconscious, no response when you yell the person's name or perform a sternal rub, which is a hard rub in the middle of their chest, blue lips or blue fingertips, shallow breathing, less than one breath every 5 seconds, or no breathing at all, a limp body with a very pale face, choking sounds or gurgling, snoring noises, and pinpoint pupils. When you encounter someone who you may feel is overdosing on an opioid, in order to save their life, you must react by administering Narcan or naloxone. Narcan is an opioid agonist and the antidote to stop the effects of opioid overdose symptoms. Narcan will not hurt an individual if they are having an overdose, if they're not having an overdose, but it will save their lives if they are. You are additionally covered by Rhode Island's Good Samaritan law if you administer Narcan on someone you suspect is overdosing from an opioid. We need to get Narcan in the hands of as many people as possible, as an overdose can happen at any time and the antidote can be administered by anyone. It is important that the first thing you should do if you suspect an individual is having an overdose is to call 911 and then administer the Narcan. Narcan will reverse the effects for approximately 30 to 90 minutes, and hopefully this will be enough time for emergency services to arrive. After taking the community response program offered by the University of Rhode Island, you will have an opportunity to have a Narcan kit delivered directly to your house. You can also go to your pharmacy and request one without a doctor's order. I have taken the online community first response naloxone Narcan training that's offered by URI, and I did receive a Narcan kit. I also learned how to use it. Administering Narcan is very simple, so I'd like to show you what to do if you encounter an individual who's overdosing on drugs. Narcan comes as an injection, a nasal atomizer, a Viso, auto-injector, or nasal spray. I received the nasal spray kit. This is the kit that I received, and each kit has 2 nasal sprays. They look like this, with 4 milligrams of Narcan in each kit. So if you come across an individual who's overdosing, the first thing remember to do is call 911. The next thing you want to do is place the individual on their back. And then you would remove the Narcan from the packaging. I'm not going to do that because I want to save this in case I do have an individual who needs it. But you would remove it and you would put the nozzle in one nostril. Make sure that you have a good seal. This will ensure that the medication is deposited right into the sinuses and there's no need to depress the other nostril. You could leave it be. Then you would depress the red activator button located at the bottom of the applicator spray, and you would give it a quick, firm push, and that administers the medication. If a second dose is needed, you would perform the same steps on the other nostril. Usually Narcan works immediately. However, depending on the medication they took or how much of the opioid, it may take a few minutes, up to 8 minutes for it to take effect. You can't administer another one without causing any harm. So knowing the signs of overdose and what you can do in this fight will help in the elimination of this global health emergency. You've learned today about issues faced with the opioid epidemic, ways that Rhode Island has focused its effort on decreasing loss of life with the URI First Responder Program, and how to administer Narcan. Although it will take time and commitment to repair this devastating epidemic, we all have an important part to play. Helping one person may not change the world, but it can change the world for one person. That was an anonymous quote. Thank you for your time.